I have observed clinically that many parents do not know how to deal with their children's mental and behavioral problems. The approach is sometimes unhelpful and may make the problem more complicated. Children's mental and behavioral problems are a great challenge for parents. So, are there ways to help? Is there anything we can do to help our children get the support they desperately need to thrive? Welcome to Dr. Young's Health Talk. Health is our own business. Today we're going to talk about better parenting for a child with mental health issues, whether it is anxiety, anger, obsessions, delusions, depression, hyperactivity, learning disabilities, or obsessional behavioral problems. If we know how to support them at all times, the outcome can be optimized. We will give you 5 essential tips to follow, so be sure to subscribe to my channel. Let's get right into the point. First, don't compare your child to any other child. Your child is unique in the origin of his soul, biochemical makeup, bioenergetic constitution, and physical characteristics. They're the only one in the universe and the best version of themselves. They need to find a unique way of learning and living and the purpose and the meaning in life. We often focus on our children's shortcomings, comparing our children's weakness with other children's strengths, instead of recognizing and exploring our children's unique potential. This will certainly hurt child self-esteem. We should learn from the mother of an autistic boy I saw the other day in my clinic. She was so proud to tell me that this child understands 8 languages, although we see on the surface that this child cannot speak and only shout. In the office, he ran around jumping. He held a book to share with me, but turned the page very quickly, sometimes even tearing off the page just read. But beneath the surface, his mom told me his reading speed was astonishing. Second, suppose you have a child with mental health issues. In that case, we should develop an integrative treatment plan for them, and we need to be flexible with the plan. Children are flesh and blood, soul and spirit, and a simple diagnosis of illness does not adequately describe the challenges they face. We must treat the child as a whole precious life. We cannot expect a one-size-fits-all, such as a simple medication or therapy, to solve the problem. Many people who come to our clinics complain that their doctors spoke to them for only a few minutes before prescribing them medications, and the therapies they went through were not very helpful. An integrative medical model in Young Institute, for example, addresses issues at structural, chemical, energetic, and spiritual dimensions simultaneously. However, even if we have discovered an effective method, it doesn't mean it will help the child. Why is that? This is the third point we want to make. No method is a magic pill or silver bullets, and can immediately solve all their mental health problems. Treatment addressing the root causes is complex and challenging and takes time, work, and effort. Most of the work falls on the patients and their parents. The skills learned and improved in the treatment room must be applied and practiced in the child's everyday living and learning. Every slight improvement must be encouraged. Why is this important? This leads to point number 4, build competence and confidence. Yesterday, a college student's patient wanted to solve his own lack of self-confidence. I told him this is a wrong target because no one was born with confidence. What makes you confident? Confidence is never a goal that we can achieve subjectively. It is a byproduct of our continuous efforts to achieve minor results, giving you the confidence and the motivation to keep trying, so you will do better and better. You look very confident when doing these things in other people's eyes, but you still feel anxious and work very hard to get things done the best you can. You're not aware of your confidence at all. Therefore, parents should always be positive and encouraging. Do not hesitate to praise even very minor achievements or good deeds your child demonstrates. Finally, we need to recognize that many of our children's symptoms are their coping mechanism to deeper inner conflicts, dysfunctions caused by biochemical and electrophysiological imbalances in their brain. Some of the coping behaviors are unhealthy, but they are their ways of coping to survive. For example, overeating to relieve depression, scratching arms with pocket knife to relieve anxiety, and taking risky behaviors to combat boredom. Only by correcting the underlying social, psychological, physiological, and biochemical issues can we make the symptoms reduce or go away. Both children and parents should understand this so they do not feel ashamed to seek professional help. One of my patients has had a learning disability since he was a child. Most troubling, he has lost many friends over the years and was recently kicked out of his fraternity because of his inability to control his anger and mean demeanor. But he insisted on not seeing a doctor and denied that he had mental health issues. When I explained to him that we were only looking for biochemical imbalances in his brain to help him with nutrients, not drugs, he was notably relieved. When I told him we could help him with neurofeedback based on analysis of his brainwaves and desensitize his emotional and behavioral reaction to triggers using acupuncture and breathing techniques, he finally accepted treatments. Thank you for watching this video. If you find this video helpful, please like and subscribe. Please also share your insights and experience and what you would like us to discuss in the future. See you next time.